My name is Autumn McCoy. This is for NUR435, and this is a chest tube educational video. So I would first check the doctor's orders and make sure that the patient was to be receiving a chest tube today. I would provide patient privacy, do hand hygiene, check the two patient identifiers, name and date of birth, and our patient here came in with trauma, so he's bleeding in his pleural space. Hey John, so you're getting a chest tube today, and that is because you have bleeding in your pleural space, which is the area between your chest cavity and your lungs. The doctor is just going to place a tube in that pleural space, and it's going to help drain the blood so that your work of breathing will be easier. You will be awake for the procedure, but you will be numbed. So you're going to be hooked up to is this right here. So there is 3 different chambers. There is the collection and measurement chamber, there is the water seal chamber, and there is the dry or wet suctioning, depending on what your doctor is going to order. So the collection and measurement chamber is it's what we measure the liquid out of, and for the first 24 hours we'll come in every hour and just draw a line to measure, because we're never to empty this. Then the water seal chamber, this is what helps prevent backflow of whatever drains out to go back into your body, and this level should be at 2 centimeters. And with this water seal chamber, we're watching for tidling and bubbling. Tidling is normal, it shows that you're breathing. Bubbling is normal for the first little bit of after it's been placed, but if it keeps on going, or if it's like excessive bubbling, then that kind of alerts us that there might be an air leak somewhere. Then we have the suction chamber, and this would be hooked up to a thoracic suctioner instead of the normal wall suction that we normally hook suction up to. So this will kind of help us know if things are draining properly or not. Please call, once this is inserted, please call and let us know if you need to reposition in bed or get out of bed for some reason. Please call if you have pain, shortness of breath, anything like that, because the tube will be sutured in, so if you yank or anything, that could be pretty painful. You can hook this up to your bed if you like it better that way, or yeah. And then we will have a Vaseline gauze over it, and just to kind of, if there is drainage that comes out of that site, it has somewhere to go and we can assess it. We'll be looking for odor, foul odor, or any purulent drainage on that dressing. We also are monitoring for crepitus, which is air that is trapped under your sub-Q tissue, which can also indicate an air leak. Then when it's time for the chest tube to be taken out, the doctor will have had an x-ray performed, and that is so we can check to see if your lungs are expanding properly the way they need to. So once we take it out, we will be documenting how you handled the procedure, any drainage that came with the gauze, and then of course your final measurement for the container.